Pancreatic cancer is a challenging disease. When caught early, before it spreads, treatment is more likely to be successful. Chemotherapy is a cornerstone of treatment for non-metastatic pancreatic cancer. Choosing the right chemotherapy regimen is crucial for each patient. Many factors influence this decision. These factors include the patient's overall health, genetic mutations, and the specific characteristics of their cancer. The goal of personalized medicine is to tailor treatments to the individual. This approach is particularly important in pancreatic cancer, where responses to chemotherapy can vary. By carefully considering a patient's unique situation, oncologists can select the most effective regimen. This personalized approach improves the chances of successful treatment and minimizes potential side effects. One important factor in chemotherapy selection is the presence or absence of mutations in genes involved in DNA repair. These genes are collectively known as homologous recombination repair, or HRR genes. Mutations in HRR genes, such as BRCA1, BRCA2, and PALB2, can make cancer cells more sensitive to certain types of chemotherapy. Patients with HRR mutations are often good candidates for aggressive treatment with chemotherapy regimens like FOLFIRINOX. This regimen combines multiple drugs and has shown significant success in treating pancreatic cancer. FOLFIRINOX can shrink tumors, slow disease progression, and improve survival rates. However, this regimen can also have significant side effects. It's important to carefully consider a patient's overall health and ability to tolerate these side effects before starting treatment. For patients who are not candidates for FOLFIRINOX, other regimens like FOLFOX or gemcitabine plus nab-paclitaxel may be considered. These regimens are generally less toxic than FOLFIRINOX but may also be less effective. The choice between these regimens depends on the patient's individual circumstances and the potential benefits and risks of each treatment. In addition to HRR status, other factors play a role in chemotherapy selection. One crucial factor is the patient's performance status. This assessment reflects the patient's overall health and ability to perform daily activities. Patients with good performance status are generally healthier and better able to tolerate aggressive treatment. They may be candidates for regimens like FOLFIRINOX. Another important factor is the patient's bilirubin level. Bilirubin is a waste product produced by the liver. Elevated bilirubin levels can indicate liver problems or a blockage in the bile duct, which can be a complication of pancreatic cancer. Elevated bilirubin levels can affect the body's ability to process chemotherapy drugs. Patients with elevated bilirubin levels may need to have their bile ducts drained before starting chemotherapy. In some cases, dose adjustments or alternative regimens may be necessary to minimize the risk of side effects. The decision to proceed with chemotherapy in patients with elevated bilirubin levels must be made carefully, weighing the potential benefits against the risks. Throughout the course of treatment, it's essential to regularly reevaluate the patient's condition and response to therapy. Imaging scans and other tests can help doctors monitor the tumor's size and look for signs of spread. If the tumor has shrunk significantly after chemotherapy, surgery may be an option. Surgery offers the best chance of long-term survival for patients with non-metastatic pancreatic cancer. After surgery, patients often receive adjuvant therapy, which is additional treatment to help prevent the cancer from returning. Adjuvant therapy may include chemotherapy, radiation therapy, or a combination of both. The type and duration of adjuvant therapy depend on various factors, including the stage of the cancer, the extent of the surgery, and the patient's overall health. Clinical trials are essential for advancing the treatment of pancreatic cancer. These trials investigate new drugs, combinations of existing drugs, and novel approaches to treatment. Participating in a clinical trial can give patients access to cutting-edge therapies and contribute to the development of more effective treatments for future patients. In conclusion, selecting the appropriate chemotherapy regimen for non-metastatic pancreatic cancer is a complex decision-making process. By carefully considering a patient's individual characteristics, doctors can personalize treatment plans to optimize outcomes. Ongoing research and clinical trials offer hope for improved treatments and brighter prospects for patients with this challenging disease. Always seek guidance from a healthcare professional to ensure you're making informed decisions that are right for you. Remember, this information is for general knowledge purposes. It's important not to rely on it alone when making critical health decisions. Consulting with a qualified healthcare provider is crucial. They can assess your specific situation, taking into account your medical history, the stage of cancer, and any other factors that may impact your treatment.